Hello, everyone, and welcome to our series, Health Promotion and Wellness in MS. Our first webcast today is focused on unlocking the keys to health success in MS. Thank you for joining us. My name is Tyler, and I will be the operator for the presentation today. Before we get started, I would like to take a moment to acquaint you with a few features of this web event technology. At any time, you may adjust your audio using any computer volume settings that you may have. On the right-hand side of your screen, you will see the text chat window. There is a large window which holds all of your sent messages and a smaller text box at the bottom where you will type in your questions. To send a question or report a technical issue, click in the text box and type your text. When finished, click the Send button. All questions that you submit are only seen by today's presenters. Your questions will be responded to in the order in which they were received and will be addressed at the end of the presentation. At the conclusion of today's program, you will be prompted to complete an evaluation. Your feedback will help us improve our future programs. We are joined today by our moderator, Marie Legrand, Director of Education and Healthcare Relations and Grant Management with the Multiple Sclerosis Association of America, and our speakers, Dr. Carrie Hersh and Shaina Meyer from the Lou Ruvo Center for Brain Health at the Cleveland Clinic in Las Vegas, Nevada. At this time, I would like to turn the microphone over to our moderator, Marie, for opening remarks.
Good evening, everyone. Welcome to the MSCA's live webinar with Dr. Carrie Hersh and Shaina Meyer, entitled Unlocking the Keys to Health and Wellness in MS. I am your host for the program this evening. We are pleased to bring you the first in our Health Promotion and Wellness in MS series. This program will highlight the importance of wellness practices and healthy lifestyle choices for the MS community, providing evidence-based information to help manage current symptoms and long-term outcomes. Additionally, this program will highlight the benefits of physical activity and management strategies addressing fatigue in people living with MS. This program has been made possible through educational funding from Biogen, Bristol-Myers Squibb, Genentech, and Novartis. Please consider completing a brief survey at the conclusion of the program. You will have the opportunity to ask Dr. Hersh and Shaina Meyer questions at the end of the presentation. I am honored to introduce Dr. Carrie Hersh. Dr. Hersh joined the faculty at the Cleveland Clinic Lou Ruvo Center for Brain Health in August 2015, where she directs the MS Health and Wellness program. She also serves as Assistant Professor of Medicine at the Cleveland Clinic Lerner College of Medicine. She completed her neuroimmunology fellowship at the Cleveland Clinic Mellon Center for MS Treatment and Research through the National MS Society Sylvia Laurie Award. She earned a master's degree in clinical research from Case Western Reserve University and her medical degree from Nova Southeastern University College of Osteopathic Medicine. Dr. Hersh received her undergraduate degree in microbiology and neurobiology at the University of Florida. As a patient advocate and proponent of shared decision-making, Dr. Hersh specializes in MS and related neuroimmunological disorders. She is particularly interested in outcomes-based research and comparative effectiveness studies. She serves as the principal or co-investigator of multiple investigator-initiated studies and clinical trials investigating the effects of disease-modifying therapies and wellness interventions on clinical, radiographic, and patient-reported outcomes. Dr. Hersh is a frequent lecturer on these topics at national and international meetings and has authored numerous publications, including peer-reviewed scientific journal articles. Currently, she is chair of the Healthcare Advisory Council for the MSCA, chair of the National MS Society's Regional Health Provider Council. She serves on the Board of Governors of the Consortium of MS Centers as co-chair of the Abstract Review Committee and serves on numerous MS steering committees. Please welcome Dr. Hersh.
Thank you, Marie. First, I would like to take the opportunity to thank everyone who is on the line tonight. We understand that this is a very busy time in everyone's lives, and I can't think of a better time to talk about health and wellness for our patients who are living with multiple sclerosis. So without further ado, let's begin. So before we get into the intricacies of health and wellness, it's first important for us to define what health and wellness is. So in my view, health is defined as a dynamic, ever-changing condition that enables an individual to function optimally. So this is your overall body's health and well-being. But wellness is a lifelong, personalized process through which people can make informed choices about their lifestyle behaviors and decide on activities across multiple interrelated dimensions in order to lead their best lives. So wellness is more of a choice. This is what individuals can do in order to optimize their overall health. But there are many key components to MS and risk of having overall worse disease outcomes. And this is where health and wellness can actually play a very important role. So there are several MS predictors that are either out of our control or in our control and preventable. So those risk factors for MS include our genes. They include whether or not we're male or female, because we understand that women have a 3-to-1 increased ratio of developing MS compared to their male counterparts. And viruses. There are certain viruses that we simply don't have our ability to avoid exposure to. But what do we have in our control? What is preventable? Now, this is exactly where health and wellness can certainly play an important role in preventing the worsening of MS overall. So vitamin D deficiency is currently a risk factor for worse MS outcomes. Tobacco smoking, being overweight, obesity certainly can play an important role. Vascular comorbidities such as high blood pressure, high cholesterol, uncontrolled diabetes, all of those can also play an important role in increasing one's risk of having worse MS outcomes. And physical inactivity. So having a sedentary lifestyle is certainly not recommended in overall good control of one's health and MS health. So let's start with vitamin D. Why is vitamin D so important? So vitamin D has important regulatory actions on the immune system and is actually considered neuroprotective. So vitamin D insufficiency or deficiency may increase one's risk of actually developing MS if one already has the genetic predisposition for developing MS. And this is true for both adults and children. And previous studies have shown that the risk of developing MS is overall lower in those who take a vitamin D supplement or who have higher blood levels of vitamin D. And previous animal studies have shown that vitamin D supplements actually slow the progression of the disease. And low vitamin D levels are also associated with an increased risk for having a relapse, new MRI lesions. That pathologically means that there is more inflammation going on in the brain and the spinal cord, and also leads to an increased risk of disease progression. So therefore, supplementation is strongly encouraged in individuals who are living with MS. And in general, we feel that vitamin D3 doses between 1,000 and 4,000 international units are probably effective and safe. However, it is very important that any vitamin D supplement and monitoring blood levels are carefully monitored by a healthcare provider. And the reason for that is because there is such a thing as too much vitamin D that can actually lead to problems with kidney health. So please, if you are taking a vitamin D supplement and you haven't had a recent vitamin D level checked, I would say within the past year, this would probably be a good time to ask your MS healthcare provider for a new vitamin D level. Usually, I'm recommending a level anywhere between 50 nanograms per mil to 80 nanograms per mil. There's no science behind whether one is going to have a certain vitamin D level taking a certain amount of vitamin D. So this is where it is actually very important for vitamin D levels to be monitored, because some people can take lower vitamin D3 supplements and have higher levels of vitamin D that is metabolically active in the bloodstream compared to other individuals. So this is why it's very important to make sure that it is being carefully monitored by a healthcare provider. I would also recommend that vitamin D3 is taken as opposed to vitamin D2 because the vitamin D3 is more metabolically active and has a more stable shelf life compared to vitamin D2. So moving on to another comorbidity, which is tobacco use. So about 17% of North Americans with MS smoke cigarettes. And cigarette smoking and vaping and chewing have all been associated with an increased risk of developing MS, and that increases by about 50% and increases the severity of MS overall. But it's not just MS that tobacco, smoking, chewing, and vaping can affect. It can also negatively impact neurologic function and quality of life, and also can increase the risk of stroke and heart disease, certain kinds of cancers, chronic obstructive pulmonary disease, osteoporosis, and pneumonia. So the mortality rate is about 3 times higher in individuals with MS who smoke cigarettes compared to those who don't smoke at all. And we actually understand that secondhand exposure to tobacco smoke also increases the risk of developing MS. And a previous study actually showed that parents who smoked at home found that there was an increased risk of a first episode of MS in their children before the age of 16 years old. So it's not just personal use of tobacco smoking, but there is also an increased risk with secondhand exposure as well. So the clear message is don't smoke, vape, or chew tobacco. It's a very, very simple message. And there are certain methods that can be employed in order to help with tobacco cessation or weaning off of smoking, chewing, or vaping. There are medications that are available, such as there are certain medications that are available. There are medications such as bupropion and varenicline that are used to reduce the urge to smoke. There are certain patches, gums, lozenges. There's counseling, support groups, and then, of course, some people just go cold turkey. But it's not an easy endeavor, and we certainly acknowledge that this is not an easy thing, especially if you have been smoking, chewing, or vaping for quite a long time. So there are folks who are available to help, and the National Tobacco Quit Line, the phone number is on this screen. And the Quit Line offers free online services, and when you enroll online, you get special tools, a support team of coaches, research-based information, and really a community of others who are trying to become tobacco-free as well. So there is a support group option that is available for those who are motivated to quit. So what about comorbidities and MS? So you may have heard the term comorbidity in the past and maybe nodded along, but didn't really quite understand, well, what is a comorbidity? Well, let me just spell it out very simply. Comorbidity means a simultaneous presence of 2 or more chronic diseases or conditions in a patient. So when we are speaking about MS, when we are saying comorbidity, we're talking about another chronic condition besides multiple sclerosis. And in the context of this particular talk, when we're talking about comorbidities, we're talking about hypertension, which is high blood pressure, hyperlipidemia, which is high cholesterol, diabetes, and chronic heart and lung disease. So those are the comorbidities that we are referring to. So we have been able to see through a systematic review of the literature that high blood pressure and high cholesterol are prevalent in more than 10% of the MS population, and chronic heart disease and strokes are actually more prevalent in folks with MS compared to the general population. And a large study that was done at the Cleveland Clinic back in 2016 showed that high blood pressure, diabetes, and chronic lung disease negatively impacted those with MS in terms of slower walking speed, increased self-reported disability, increased depression, and it was found that high blood pressure actually had the greatest negative impact in relationship to all of the other comorbidities that were studied. So the American Academy of Neurology in 2018 actually presented a number of works in the health and wellness field and comorbidities in MS. And their research showed that in patients with early MS, high cholesterol and resting heart rate were correlated with worse brain cortical atrophy, meaning brain shrinkage, with a stronger relationship in men. So we understand that in MS, folks are already at an increased risk of having brain atrophy or brain shrinkage because of the chronic neurological changes of these white matter lesions that lead to irreversible scarring down and death of neurons and nerves. And we understand that certain health comorbidities, like these vascular comorbidities, can further increase that risk as well. They also showed that current or former tobacco smokers and folks with higher body mass index, for those who were obese, predicted worsening disabilities such as slower walking speed and increased depression in folks with MS. So overall, what we would like for our patients to understand is that making positive lifestyle choices are really crucial for overall wellness in MS. And this is in addition to disease-modifying therapies that we are typically recommending to decrease the inflammation and overall worsening of MS on a more long-term scale. But these health and wellness measures certainly have an adjunctive role in making sure that our patients are leading their best lives forward. So those positive lifestyle choices include regular physical activity that are, of course, geared to your abilities. Certain folks struggle with certain levels of disability that may reduce their ability to do certain kinds of exercises, and it can certainly decrease the endurance level. And Shaina Meyer will be able to go into more specifics about exercise and physical activity and certain compensatory strategies that can be used in the face of certain disabilities as they are related to MS. But healthy eating, weight control, seeing a primary care provider on a routine basis, seeing their MS care provider on a routine basis, and of course, implementing preventative health measures such as quitting smoking, limiting alcohol use, paying attention to personal safety, and developing a healthy social network are all positive key attributes to maintaining good MS health. So what are some of these things that individuals can do on a more routine long-term basis? So one is preventative care. So in the MS field, we find that it is important to establish a strong relationship with a primary care provider who has an interest in long-term care and those who are living with MS. And it's important to have a collaborative, multidisciplinary relationship with a primary care provider to make sure that age-appropriate cancer screens and age-appropriate vascular screens are done in order to improve your overall health. So, for example, making sure that blood pressures, cholesterol, and simple blood sugars are checked on an annual basis to make sure that someone isn't at a risk of developing diabetes. A goal blood pressure would be less than 120/80. Getting a height and weight to screen for obesity. And then, of course, age-appropriate health screens in terms of cancer prevention. So for women, it would be pelvic exams and pap smear, self-breast exams, mammogram every 1 to 2 years for those who are 40 years of age and older, and a colonoscopy greater than the age of 50 years old as long as there aren't other family risk factors for colon cancer where you may need to get a screening colonoscopy at an earlier age. For men, same thing with colonoscopies, but having testicular self-exams and prostate exams on an annual basis after one turns 50 years old, those would be important. So the next thing I have on this slide is immunizations, and this is a very hot topic, and this deserves a talk all in of itself. But very briefly, Any vaccine that is considered a killed vaccine or a dead vaccine or an inactivated vaccine is probably considered safe in folks who are living with MS. So this includes the annual flu vaccine, this includes the pneumococcal vaccine, and it includes some chickenpox vaccines, but there are other live attenuated chickenpox vaccines, so it would be very important for you to specifically ask your primary care doctor or your MS healthcare provider which vaccine would be appropriate for you. In general, people with MS should avoid live attenuated viral immunizations when possible, especially if they're taking certain disease-modifying therapies, including the immunosuppressive medicines. So in terms of nutritional wellness, to date there really is no specific diet that has full evidential consensus support for improving MS outcomes. And one of the reasons for this is it's very difficult to conduct a randomized controlled trial when it comes to diet. And this is something that is very difficult to study in a robust clinical trial. But to the best of our ability, what we've been able to find is an anti-inflammatory diet such as the Mediterranean diet is probably one of the better nutritional regimens that you would be able to follow to reduce the risk of future inflammation and promote overall good health care. And this would include whole grains, whole foods such as colorful vegetables and fruits, lean proteins and fish, making sure that you are eating a diet that is high in fiber such as leafy greens, and then of course remaining well hydrated and drinking plenty of water. This is so hydration is very important generally speaking, but in folks with MS, one potential symptom is chronic constipation, and drinking plenty of water and eating a diet that is high in fiber will help promote bowel motility and decrease the risk of constipation. But there are a lot of other diets that have been discussed in the community, such as the Swank diet and the Paleo diet. And currently, we don't have full evidential support to say without a doubt these diet fads do decrease the risk of MS or do improve certain MS outcomes. So we want to be very careful about what kind of diet we are endorsing. But a good anti-inflammatory diet is good for overall health in general. So this is what we generally promote at our center. But things to eliminate include high salt, processed foods, sugary beverages, simple sugars, and high saturated fat. And some of the reasons are because some of these food options increase the risk of diabetes and obesity and high blood pressure. So some of these things are good habits to have just to improve overall health. And risk of malnutrition and obesity. So according to the National Institute of Health, a body mass index that is greater than 30, so for example, someone who weighs 180 pounds and is 5'5", is considered to be obese. And we have seen in prior studies that obesity can lead to impaired immune function, worsening of muscle weakness, fatigue, urinary difficulty, and depression. And obesity before the age of 20 years old is associated with an increased risk of MS. So maintaining a healthy weight, where physical activity and a good healthy diet are keys to decreasing weight and promoting weight loss, are certainly things that we would encourage for overall general health. But what about other things to promote health and wellness in MS? So sleep. Sleep is a big topic in MS, and a lot of people do struggle with sleep-related issues, whether or not they have trouble falling asleep or they have trouble staying asleep and they're waking up throughout the night. So we do have some tips of the trade that we'll be able to discuss in just a couple of slides. But the first thing that I do want to emphasize is that sleep is involved in healing and repair of your heart and blood vessels. Sleep deficiency is linked to increased risk of heart disease, kidney disease, high blood pressure, diabetes, and stroke. Sleep promotes healthy growth and development, and the immune system relies on sleep to stay healthy. So this is one of the reasons why we promote healthy sleep practices. And if an individual is having trouble with sleep, or there is a risk of obstructive sleep apnea, we refer patients to a sleep medicine specialist for a polysomnogram to make sure that they aren't suffering from obstructive sleep apnea, because this is another risk factor for increased vascular risk factors, increased heart and lung disease, increased risk of stroke, and of course can impair the overall quantity and quality of sleep. So we want to make sure that we are getting a good understanding of someone's sleep habits and whether or not they are struggling with that. So some sleep hygiene tips. So sleep only long enough to feel rested, and then once you feel well rested, get out of bed. Go to bed and get up at the same time every day. So you want to develop a good routine every single day. So if you are waking up at 5 a.m. during the week, then the recommendation is to try to wake up at around the same time over the weekend. And the reason for that is because if you are going to sleep at different times, you are going to alter your sleep-wake cycle that may actually impair your ability to fall asleep easily during the week. Do not try to force yourself to sleep. If you can't sleep, get out of bed, do something else, try again later. Really try to limit caffeinated products and alcohol close to bedtime, and avoid smoking. Make sure that you keep your bedroom dark, cool, quiet, and free of reminders of work and other stressors. The bed is your sanctuary. You don't want to associate your bed with other things that cause stress, because stress increases your cortisol levels, and increased cortisol levels, which is a steroid, will keep you up. To the best of your ability, try to problem solve before you go to bed. Exercise several days per week, but not right before bed, and the reason for that is because we release endorphins after exercise, which may impair your ability to fall asleep. Avoid looking at phones and reading devices such as e-books that give off light before bed. If you have too much light exposure, this is going to decrease your melatonin production, and melatonin is used for sleep. Relaxation therapy, in which you focus on relaxing all the muscles in your body one by one, is also something else that you can try. Yoga, meditation, deep breathing exercises can help with sleep and improving sleep latency. And then if all else fails, working with a counselor or a psychologist to help manage the problems that might be causing poor sleep is certainly something that can be entertained. And of course, if there is a risk of obstructive sleep apnea, snoring throughout the night, waking up in the middle of the night, panting for breath, needing to sleep with multiple pillows behind the neck, or waking up with headaches, please notify your healthcare provider for a sleep study. Emotional wellness is also very important. So this is important to develop coping strategies to enhance problem solve, manage stress, and like I had mentioned before, certain things like yoga, Tai Chi, meditation, Reiki, all of these things can help with emotional wellness. Develop resilience in the face of unpredictable changes, and this is certainly a big topic today with the COVID-19 pandemic. So really being able to work with yourself and work with others in trying to manage your stress and looking for ways to decrease that stress will also foster emotional wellness and a positive outlook overall. And remain aware of mood changes, including depression and anxiety, that may require treatment. So depression and anxiety are also comorbidities with MS, and there are approximately 25 to 35% increased risk of having depression or anxiety with MS compared to the general population. So this is something that is also very important to discuss with your healthcare provider if you are struggling, because this is very treatable. It's treatable with either medications, with psychotherapy and counseling, or a combination of the two, which tends to be the preferred method. But spiritual wellness is also a big component, and it goes hand in hand with emotional wellness. And spiritual wellness is not religion. And if you do get spirituality through religion, that is wonderful. But you don't have to be religious in order to be spiritual. Spiritual wellness is really all about developing a worldview that promotes a sense of peace and harmony and enables yourself to cope and adapt through your life. And really the ultimate goal is to find meaning and purpose in the face of your own personal challenges. And this also can be a lifelong journey that you take with yourself and your loved ones in order to find inner peace. Occupational wellness is also important as well because it provides us meaningful and rewarding activities that promote a sense of purpose and accomplishment, which is also helpful for psychological well-being and self-confidence. And this includes opportunities that contribute to your unique skills and talents, and this can be either at work or at home or in the community through volunteering. But really, it's important to understand your rights. So the United States Department of Labor prohibits discrimination against people with disabilities in employment, public accommodation, communications, and governmental activities. And there are things called reasonable work accommodations. And if you don't have a good understanding of what that means when it pertains to you, do you have certain accommodations that are available to you and you just don't know, this is where touching base with your human resources at your place of work or social work services to review individual cases and go over with you what is available to you so you can try to maintain gainful employment. And engaging in mentally stimulating and challenging activities to enhance personal growth, creativity, and new learning is also very important for maintaining intellectual wellness. And really what we want to encourage is to learn and embrace new activities, develop new skills and interests, take up a hobby, study a new language, learn a musical instrument, do puzzles, read, engage in creative activities, study, get educated, and some people actually think about going back to school, auditing classes at a local community college, and earning a new degree. And social wellness. So this is about developing a positive, healthy relationship with your family, with your friends, and with your community. And this is to promote active engagement in a social network of meaningful relationships and friendships. And this is important for overall social wellness. And participating in educational programs like tonight's program, participating in local support groups, and even volunteering can give you a feel for social wellness and remaining connected with your community. So with that, that is the conclusion of my talk, and I will be happy to answer questions at the end of the program. But I'm going to kick this off to Marie to introduce our next speaker. Thank you very much.
Thank you very much, Dr. Hersh, for the wonderful presentation. I am honored to introduce Shaina Meyer, our next speaker. Shaina Meyer received her bachelor's degree in psychology from Westminster College in Fulton, Missouri, and master's degree in occupational therapy at St. Louis University. As a licensed occupational therapist, she has worked with individuals with a broad range of diagnoses and developed a special interest in evaluating and treating individuals with progressive neurologic deficits. Since joining the Louisville Center for Brain Health, she has earned her MS Certified Specialist certification in order to better care for and meet the needs of her patients living with multiple sclerosis. Without further ado, please welcome Shaina Meyer.
Hello and good evening. Thank you, Dr. Hersh, for setting us up for such a great presentation this evening. So what I hope to help you all understand now is that last piece in more detail of physical activity, the very important piece when it comes to health and wellness in living with multiple sclerosis. Okay. I need help advancing the slides, please. I think so. While I'm just trying to find my arrow here, I just want to talk tonight about exercise and why it's so important and how people with MS can incorporate these principles into their life and how to combat fatigue, because fatigue is one of those things that we all live with. So why exercise is so important for having MS? It is safe and it is effective. Many years ago, they were skeptical that exercise was good for people living with MS, but it has been shown to be very safe and even more effective than people realize. So regular exercise should be prescribed and implemented very early on. Tailored exercise programs starting as part of your disease-modifying therapy as another form of medicine can work alongside your medications to help reduce the risk of other relapses and progressions of MS. Additionally, exercise has a very positive effect on a multitude of symptoms. Long-term, regular, moderate to high-intensity exercise, and we're going to talk a little bit more about what that looks like, can potentially postpone the onset of clinical MS diagnosis and can postpone the occurrence of disease activity and progression. It also reduces worsening of prominent symptoms. So other benefits. So we know now that exercise is great for if you have MS to help reduce the risk of having a relapse. But additionally, it can help with sleep, which Dr. Hersh talked about earlier. It can improve somebody's self-esteem. It can help decrease symptoms of depression and anxiety. It can improve quality of life. It improves social interaction, especially if you partake in group exercise. You get increased mental stimulation and cognitive health, both of which were important pieces of health and wellness, weight management, and comorbidities, that fancy word we were talking about earlier in this presentation. It can reduce your risk for many comorbidities. The some comorbidities that can be reduced by exercise are cardiovascular disease, such as heart disease and stroke, two of which are leading causes of death in the United States and make it much more difficult to manage your MS. Additionally, it lowers your risk of type 2 diabetes and metabolic syndrome. It can also reduce your risk of some cancers like bladder cancer, breast cancer, colon cancer, stomach cancer, and even a few more. It also slows the loss of bone density and lowers the risk of having a hip fracture if you fall with aging. Generally, exercise can positively impact fatigue, reduce pain, reduce depressive symptoms, improve walking, improve balance, and improve cognition. So it's a pretty great thing. Plus, it reduces fatigue. I know that sounds a little random. Like, if I'm really fatigued, how is exercise going to make me feel less fatigued? Isn't it going to make me feel more fatigued? But it's actually one of the best ways to build endurance and reduce fatigue when you're living with MS. You just have to know how to do it the right way. So I'm going to talk about that today and additionally talk to you about who you can meet with if you need more help getting there. And I want to remind everybody on the call today that it is never too late to start. So, what is fatigue? Well, there's a couple different pieces that come with fatigue. So there's primary fatigue, and that's what you have when you have MS. It's a fatigue that's there all the time, never really seems to go away. It can be described as an overwhelming tiredness at any point in the day. And it's not typically correlated with any activity level or sleep. If you sleep really well, you'll still have fatigue. And it can definitely be exacerbated for some people by heat. But there is also a secondary fatigue, and this is the kind of fatigue we're talking about modifying when it comes to exercise. Secondary means that there are other reasons that are making your fatigue worse than it could be. So secondary symptoms would be mood disorders and stress. They can cause more fatigue. Comorbidities, as we keep referring to throughout today. A poor diet, sleep, pain and spasticity, a decrease in physical activity because you get muscle weakness and deconditioning and certain medication side effects. All of those things I just named can lead to more fatigue. So the implications of fatigue, well, it's kind of what we're talking about right now. If you have fatigue, you're less likely to want to exercise. So it can lead to physical deconditioning. It also reduces the ability to complete meaningful or necessary activities. Being an occupational therapist, oftentimes people will start to have impairments in activities of daily living, and fatigue can make that even worse. It can also be misinterpreted by others, or at least felt this way or perceived by a person living with MS, that others might feel that they appear lazy or disinterested, which typically is not true. It's just that fatigue is very powerful and plays a very large role in people's lives. So I think that it's really important to address that. If you don't understand about fatigue, it might be a great time to meet with an occupational therapist and discuss how it's impacting your activities of daily living. So how much exercise? Well, this varies depending on many different factors. Everybody needs a different amount, and it really depends on your limitations and your barriers and kind of where you're at with physical activity right now. So if you have very mild symptoms of MS, you may want to be able to build up pretty progressively, pretty quick. So if you look at the top of this model, ideally you want to shoot for strengthening 2 to 3 times a week, and you want to aim at doing 8 to 15 repetitions of all of your major muscle groups. Some good ways to do strengthening are through using weights, using free weights, using elastic bands, body weight supported exercise. Traditionally, weight machines are preferred, but especially during times like right now with COVID, there's a reduced access to using weight machines unless you have them in your home. You definitely want to start a resistance or strengthening program by being supervised by experienced staff, especially if you don't know what you're doing. Another piece of this is aerobic exercise. So aerobic exercise is using an arm bike or a leg bike or a treadmill or water aerobics, anything that gets your heart rate up. And you want to aim for 10 to 40 minutes. I know that's pretty variable, but again, it depends on what stage you're at. And you want to shoot for getting up to 60 to 80% of your maximum heart rate. That depends on your age. That can be looked at online, or you can meet with a physical therapist to determine what 60 to 80% of your heart rate is. Another thing that you can do if you're just really not sure if you're working hard enough is just ask yourself, how hard am I working? This is called a rating of perceived exertion. And you want to shoot for telling yourself, I'm working light to somewhat hard. I'm working kind of hard would be a great way to feel. You shouldn't feel like you have to work extremely hard or very hard, but you shouldn't be doing it too easy either. You want to be somewhere in the middle. Stretching. So you want to aim for stretching daily for 10 to 15 minutes. This can be accomplished through yoga or through specific stretches that you feel you need. This is particularly important if you're dealing with spasticity as a symptom of MS. And you want to incorporate balance and coordination. You can do that on your own, or you can work with a therapist to establish what coordination or balance exercises might help you. Some other great options are yoga and Tai Chi. So that's kind of what you want to shoot for optimally, are those recommendations right there. Now, if you're having more moderate symptoms or you're new to exercise, you want to start with at least daily doing active range of motion. Active range of motion is moving your arms and legs against gravity without any added resistance. You're just moving. It's kind of like aerobics outside of a pool. You additionally want to make sure you're getting that aerobic exercise in, so modify it as you need to. If you don't know how to modify your aerobics, that would be a great time to work with a therapist. But modified aerobics would be maybe using machines that are easier to get on or off of, or maybe just doing sitting and repetitive movements until your heart rate starts to go up. there are a lot of different ways to do safe aerobics if you're not able to get on a bicycle or a treadmill. And then you want to use some form of resistance exercises for balance and coordination as well. Balance and coordination are very important. Now, if you have very severe symptoms that are happening, or if you've just never done any exercise at all, you may want to just start with having another person help you with stretching and see how that goes, and then progress that over time to add in aerobics. So passive range of motion is when somebody else is stretching you and helping you to move your limbs. So just a few precautions I want you to keep in mind when it comes to exercise. People that have MS are susceptible to exercise-related fatigue at the beginning. So as I said earlier, that fatigue can be reduced by exercise. It can also be exacerbated if you're doing too much. You have to be realistic with yourself. One tip we give people we work with here in our clinic is the 2-hour rule, and that after you're completing your exercises, 2 hours later, you should feel slightly about the same as you did before you started. If you feel way worse and way more fatigued after you're done by 2 hours, you probably overdid it. So it's best to try to take it back a notch next time and try not to work as hard, and then build that slowly up over time. You also want to use cooling devices, which we'll talk about in a minute. And I also want to talk today about when you would work with a physical or an occupational therapist when it comes to exercise. A physical or occupational therapist can help you evaluate specific target areas and help create a plan so that you know how to build yourself up over time without overdoing it. They can address your specific barriers to exercise, whether that be your environment and not having certain equipment, or pain, or vitals, so your blood pressure or heart rate. They can also educate you on proper technique to make sure that you're doing it right and teach you how to do it right. They can also train another person to help you. So I know I need to exercise now, so hopefully after talking about that, you're getting the idea of how important exercise is and about how much exercise you need. Again, that's variable from person to person, but still there's that really big barrier of fatigue. You're tired. So I'm going to talk about some different options right now of how to still have enough energy and enough gumption to get out there and exercise so you can stay physically well. So the first thing is make it fun. As an occupational therapist, one of the biggest things I remind people that I work with is you've got to have fun. Exercise isn't that exciting. There are very few people in this world who like to exercise, so you got to make it interesting. So use activities you already enjoy. Try something new that you've been wanting to try. Get a buddy. It's always more fun when you have somebody with you, and then you're adding that social aspect in. Use music. Music can really make it more exciting and get you more into the rhythm. And then reward yourself. And there are different types of rewards. Intrinsic rewards are what you feel internally about exercise. So gratitude journaling and thinking about how exercise is changing you is an intrinsic reward. Extrinsic would be like, if I exercise, I'm going to get myself something really cute and awesome to wear next time. Or maybe it's ice cream. Set realistic goals for yourself. So you want to start slowly. One thing that I tell everybody that I work with is be honest and patient with yourself. Set small goals for yourself over time. Don't try to jump in head first and just go. That's going to impact your fatigue, and that's going to make you feel unsuccessful. You need to be very specific with yourself. What exercise are you going to do? When are you going to do it? What's a good time of day for you? Where are you going to do it? How long are you going to do it? The more specific you are with yourself, the more likely you're going to get onto that exercise bike, or go pick those weights up and use them, or go to a gym whenever it's safe. You want to work physical activity into your existing daily routine. Try to find ways to incorporate exercise into things that you're already doing. And then track your progress. Progress looks different for every person. You need to ask yourself, what does progress look like to me? What am I looking for out of exercise? Do I want to decrease the impact of my fatigue? Do I want to get stronger? Do I want to lose weight? Progress looks different, so track whatever progress means to you. Make sure you stay cool. A lot of people with multiple sclerosis don't want to exercise because when they get hot, they start to have symptoms that feel like they're getting worse for a short period of time. So there's a lot of ways to stay cool. My MSAA has an article on different cooling products that you can consider. They also have a program where you can apply to get those covered if you qualify financially. There's a lot of different cooling garments out there. There are neck wraps, there are inserts for your bra, there are cooling vests, there are hats. There are so many different options to stay cool while you exercise. Also, stay hydrated. Drink plenty of fluids. You want to cool your environment if you need to do that, and pre-cool your body. The 5 Ps. So there's a lot that goes into energy management. This is another piece of managing fatigue so that you are more successful with thinking about starting exercise. If you're spending all of your energy just getting yourself ready for the day and just going to work or just taking care of your children or just taking a shower, you're going to be less likely to exercise. So energy management is just a principle of looking at your life and where you might be able to conserve energy so that you can set aside energy for specific exercises. So I put this together into 5 Ps for you today. Planning. Planning is very essential for managing your energy. Not everybody's a planner to begin with, so this can take practice, but just start small. Look at your schedule. Try to find time where you can spread out your activities so that you're not congesting them all into one part of your day or one part of your week. If you do that, you're going to have more fatigue. Prioritize. Prioritize what is most important to you. What has to be done today? Make lists for yourself. Delegate tasks to other people in your family or your friends if you need help. And then determine whether expectations of yourself and others is realistic, and then modify that as necessary. Pace yourself. Balance activity and rest. So fatigue that's there all day is going to be there. But what you want to do is learn to rest before that fatigue feels so severe that you can't do anything else. If you keep pushing yourself because you feel good, you're going to get into this cycle of doing too much for too long, and then you have to rest for days at a time. You want to get into more of a routine where you're doing a little activity every day and resting a little every day and balancing that. Consider what time of day is best for you. Don't rush. Rushing makes you more tired and also impacts your breathing. Try to complete a task before starting another, and use labor-saving devices and adaptive equipment. That's particularly something that you can look at when it comes to cooking or cleaning. There's so many different pieces of adaptive equipment to help you reduce your energy expenditure. The last 2 Ps are position and posture. You want to use good posture and body ergonomics, which is how you sit in a chair when you're working or doing house tasks or doing anything at home. You want to avoid staying in one position for too long, even if that's sitting. You don't want to stay sitting in one position for too long. And you want to sit when able when you're doing things that you have to do. So I'm not telling you to just go sit all day, but you do want to sit if you're trying to conserve energy. That way you may have more energy to do something fun or to exercise. And don't be afraid to ask for help. And the last one that I said earlier is patience. Be patient with yourself and take frequent rest breaks. And some things may take longer than they used to, but at least you're being patient with yourself. And make sure you practice relaxation and breathing techniques. Breathing can actually reduce your fatigue through way of breathing better, and you'll have more energy, especially when you're exercising. One very important question that you want to ask yourself is, what do you find restorative? The restorative activities help you to restore your energy. So I think that a lot of people maybe don't take time to really think about what increases my energy. What do I find really important? What do I really like to do? What makes me happy? So think about what that is for you and use those activities within your day or within your week to help restore your energy so that you have more of it. And then here are a couple apps for self-management. There's so many more out there, but sometimes we just need a little bit of help. And there's so much great technology out there. So there are trackers in apps to help manage your MS, to see if there are any changes in your mood or symptoms throughout the week. You can track exercise. There are apps out there that help you take shortcuts to finding more time in your day. There are apps to help you be a more organized planner if you're not naturally good at that. There are apps to help you remember things. So if cognition or memory is a problem for you, maybe you need reminders to exercise or to stay fit or to move every so often. And there's a lot of other apps out there. There are a lot of mindfulness and relaxation apps that you can help to restore your energy, as we just talked about. Insight Timer and Headspace are just two of them. So there are so many great apps out there. I put a few on the slide here for you just to get you started of looking for something that might help you, where you might be missing out on something. And if you want to find out more, if you don't know where to start with exercise, or you're feeling lost, or you just need a refresher, I highly recommend getting a referral to your local physical or occupational therapist, particularly if you have an MS specialist in your area. You also want to check out local and national resources if you don't already. And then my MSAA has a variety of resources that you can check out. And throughout the slides tonight, I've listed some different articles that they have that relate back to exercise, types of exercise, fatigue. So they have a wealth of information online that you can check out to learn more about fatigue and exercise, because unfortunately, I don't have all the time tonight to tell you everything, because that would take days, but there's some great articles out there if you want to learn more. And now we're going to get into a case study, so I think I'm going to let Marie take over.
Hi there. Thank you so much, Shaina, for the wonderful presentation. I will now turn it over to Dr. Carrie Hersh for the case study background.
All right. Well, thank you, Shaina, for that very inspiring talk on the importance of fatigue management and exercise in MS. I'm sure the audience would agree that you provided a lot of really solid and helpful background on the importance of exercise. So let's go ahead, and we're going to culminate tonight's program with a case study that will bring us into the Q&A session of the program. So let's talk about Cindy. So Cindy is a 35-year-old woman living with MS who works full-time. She has a daughter and husband and is concerned about her busy schedule and intense level of fatigue at the end of the day. Her family and work schedule pose significant challenges to abiding by a health and wellness plan, including exercise and eating well. So Cindy's case is actually a very typical case that we see in the clinic. Someone who is young, she works, she has a young family, and she struggles with fatigue. And so she wants to know what is the best way that she can implement exercise into her routine that works for her. So let's talk about this further by starting off with a question. So the question is, what would be an ideal solution for Cindy to find time to exercise more often? And this is where I'm going to ask the audience to pull in with the answers to their questions. So the first response is exercise as much as possible on the weekends, take short walks during her lunch hour, exercise when there is time available before bed, and do seated exercises at her desk during downtime at work. And I'm going to ask you to go ahead and log in your answers, and then in a few seconds I will go ahead and I will report the summary of the responses. Okay, Well, I think that we have settled into a couple of responses that received the majority of the feedback. So 56.7% of the respondents mentioned it might be a good idea for her to look into taking short walks during her lunch hour. And then about 40.5% of the respondents selected do seated exercises at her desk during downtime at work. And a couple of percent each had recommended exercise as much as possible on the weekends or exercise when there is time available before bed. So I want to, just make sure that we are emphasizing that while exercise is very important, exercise right before bed may not be the best decision because, again, it releases endorphins and actually may increase the possibility of having trouble falling back asleep or falling asleep for bedtime. So she may not want to exercise right before bed. And then with exercising as much as possible on the weekends, while it is possible to go ahead and try to catch up on some exercise over the weekends, folks also want to be careful about doing too much all at once because that might actually increase their level of fatigue if they're overly exerting themselves. So the answer is taking short walks during the lunch hour and doing seated exercises at her desk during downtime at work. Those seem to be pretty reasonable solutions to finding some time for her to do some exercises during her busy work schedule. So we're going to go ahead and we're going to move on to the next slide, and we're going to review some of the case details a little bit further. So Cindy works in an office and frequently picks up fast food near her workplace during her lunch hour and gets snacks and beverages from the vending area throughout the workday. After work, Cindy commutes to pick her daughter up from aftercare before taking her to gymnastics. And then after sitting down to dinner, often takeout or frozen meals with her family and helping her daughter with homework, there's little time left for exercise, nor does she have the energy. So what other lifestyle changes with respect to diet could Cindy make to further improve her overall wellness? So the first response, choose healthier takeout options for lunch whenever available. B, meal plan and pre-prepared dinners incorporating vegetables, lean meats, and whole grains. C, pack salads and other healthy choices for lunch. D, bring dried fruit, nuts, granola, and a water bottle to work for midday snacking. Okay, so it looks like we've got a few answer choices that have been selected. So the second bullet point, B, meal plan and pre-prepared dinners incorporating vegetables, lean meats, and whole grains. That certainly sounds like a very healthy option for the patient. It looks like this would be incorporating an anti-inflammatory Mediterranean-based nutritional regimen. So that's something that makes a lot of sense. Pack salads and other healthy choices for lunch. Sure, absolutely. Salads have whole, healthy leafy greens in them. Some people pack fruit salads. So anything that is whole, that is maybe even organic-based, certainly would be good options for her to bring to work. Bring dried fruits, nuts, granola, and a water bottle to work for midday snacking. About 13.7% of the respondents voted for this, and that is also a very healthy option for her midday snacking. The first answer choice, which about 6% of the audience picked, choose healthier takeout options for lunch whenever available. While, yes, healthier options are certainly better, folks have to be careful about takeout because foods that tend to be prepared outside of the home, they tend to be littered in salt, and salt and high sodium can increase the risk of having high blood pressure and other vascular risk factors. So when able, it is better to prepare foods in advance at home so you have complete control over what you are putting into your meals. So now we're going to go ahead and we're going to move on. So in conclusion, after speaking with her healthcare provider, Cindy spends 30 minutes during her lunch hour walking every day. Packing salads and other healthy options for lunch gives her more time to be active during her free time every workday. Meal planning on the weekends have also resulted in healthier dinners as well, and being active every day has improved Cindy's energy levels overall. And with that, I'm going to conclude this part of the program, and I'm going to ask Marie to moderate the question and answer period.
Thank you very much, Dr. Hersh, and thank you once again, Shaina Meyer, for the wonderful presentations. The first question that we have is, I have found meditating, imagining my body healing, as a very powerful tool. It has helped me a lot. Is this something that has helped others?
Yeah, so I can go ahead and I can start off. There has been increased interest in meditation and Tai Chi and certainly yoga practices as modes of exercise and strategies that people can do in order to help promote emotional wellness, psychological wellness, decrease stress, and in particular, yoga potentially has a very strong role in not only exercise, for which yoga is really good for core balance and strengthening and flexibility, which are all modes of exercise domains that Shaina talked about and is certainly recommended in overall MS health. But yoga is also good for relieving stress and for connecting with the body, and actually provides an overall sense of well-being and peace. And at the Cleveland Clinic, we are very lucky to have a yoga program that we have implemented into our own health and wellness program that has been very helpful for our patients. So I would like to thank the participant for that comment and to go on to say that, yes, other individuals in my practice have said that those kinds of strategies have been very helpful for them.
Thank you. Next question. What happens to the patient with MS when there is a significant amount of white matter in the spinal cord?
So MS is a very heterogeneous condition, meaning that people present very differently when they have this condition. And some of this is related to where the MS is in the body of that particular individual. So MS can affect the optic nerves, it can affect the front part of the brain, the back of the brain, and the spinal cord. And for individuals who have lesions in the spinal cord, it can lead to many types of disabilities that can potentially be irreversible and could certainly impact one's ability to function in their everyday routine compared to what they were able to do before. So some of those things include bladder dysfunction, bowel dysfunction, numbness and weakness in the arms and the legs, and having mobility problems. And what we understand is that if there is a considerable amount of disease in the spinal cord, this increases the level of physical disability and also increases the risk of having more disability in the future if it's not controlled on a medicine.
What percentage of relapsing and remitting MS patients progress into a more severe form?
So a very simple response to that answer would be about 85% of individuals present with relapsing remitting MS, which essentially means periodic worsening of either old or new MS symptoms, and then eventually either improving all the way or improving with residual disability. And then about 65% of those individuals have a risk of going on to develop secondary progressive MS about 15 to 20 years after the onset of their first symptoms. So that's the natural evolution of MS without having any intervention with a disease-modifying therapy.
Thank you. Medicare will not cover a vitamin D3 test. What should I do as I am on disability and my funds are limited?
So I don't think that that is an issue with Medicare. I think that that is an issue with coding. So when a vitamin D level is ordered, the provider needs to make sure that they are coding for vitamin D deficiency, and the insurance company may pick that up more readily. So just make sure that the proper diagnostic code is being used.
Is it necessary to have an MRI of the brain, cervical, and thoracic spine done every year?
The best thing to say in regards to that is, generally speaking, annual brain MRIs are recommended for routine surveillance of MS. And the reason for that is because there can be subclinical worsening of MS lesions, either getting bigger or new lesions developing without the person actually knowing about it. Less frequently, spinal cord lesions develop without knowing. Most of the time, when spinal cord lesions develop anew in the spinal cord, a person will have new or worsening symptoms. In my practice, I do perform annual brain MRIs for surveillance. Spinal cord MRIs I typically don't do as often, and I usually make sure that I have baseline spinal cord imaging for a future comparison, and then I will certainly do spinal cord imaging if I am suspecting that there is a new spinal cord syndrome occurring. And I may check in on spinal cord imaging every now and then, depending on the individual and where their MS lesion burden is located. But through the consortium of MS centers and Magnum's program, it is recommended that an annual brain MRI is done for folks to monitor MS over a longer period of time.
Is intermittent fasting safe while taking a DMT? So intermittent fasting diet, there's actually a lot of interest in this field, and there have been quite a bit of work going into this. So, as I mentioned, overall, dietary interventions, overall, we have not provided substantial evidential support as being effective in the treatment of MS. But there have been studies showing this periodic 3-day cycle of fasting mimicking diet or intermittent fasting diet as potentially being effective in an animal model of MS. And in that animal model, there were improvements that were seen in about 20% of those animal models. And the overall thought was because there were fewer numbers of pro-inflammatory cytokines or proteins and cells that would instigate future MS attacks. And it also looked like there was a benefit in supporting the positive effects in reducing autoimmunity and increasing the ability for remyelination. So while we don't have great human data right now, it is suggestive in animal models that an intermittent fasting diet may actually decrease overall inflammation and potential for autoimmunity, and may actually
promote remyelination. There's also some report on some preliminary data suggesting that an intermittent fasting diet or a chronic ketogenic diet are safe and feasible and potentially effective, specifically in folks with relapsing remitting MS.
Should MS patients take a vitamin C supplement?
So that's actually a great question. I do want to remind the audience that vitamin C is actually pro-inflammatory. So people take vitamin C to try to ward off infections. But in doing so, that may actually, if taken in high quantities, may actually promote inflammation. So I would recommend that things like either drinking orange juice or just making sure that you are remaining healthy overall with all of the different features that we talked about during today's visit, eating well, getting a good night's sleep, exercising periodically, going to the doctor, making sure that you are reducing your vascular comorbidities. All of these things will be really instrumental in preventing risks of infections. I would say that if vitamin C is taken, to make sure that you are limiting it, I would say probably no more than 500 milligrams a day. But there is not as much evidential support for taking a vitamin C supplement as there is evidential support in these other health and wellness features.
Is a shingles vaccine recommended?
So as I had discussed in a prior slide, the VZV vaccine can be taken safely as long as it is the inactivated version. So if you talk to your primary care doctor or your MS healthcare provider about getting the VZV vaccine, make sure that you are getting the inactivated form of the vaccine.
Thank you. Would it be safe to start a new MS drug when you are over 60 years of age?
That is a very big topic in looking at disease-modifying therapies in the aging population. And the simple answer to that is it depends on the individual. It depends on whether or not they have new relapses, new inflammation in the way of MRI lesions, and what does their overall health look like. So I don't really like to say that it's not safe or it is safe in a certain age population. It really depends on the individual's MS. Is there the overall thought that the individual will benefit from a disease-modifying therapy given their overall disease course and their disease history? And do they have any comorbidities that would increase the risk of taking certain disease-modifying therapies? So it really depends on the individual, and it depends on the disease-modifying therapy itself.
Thank you. Thank you for this webinar. I am currently out of the country and can't get any medication. What can I do until I return to the U.S.? I have progressive MS.
So I would say that making sure that you are abiding by a healthy lifestyle, just like we had talked about during today's during today's talk, making sure that you are seeing a healthcare provider, reducing your comorbidities, taking some vitamin D because that is shown to have some neuroprotection, and making sure that you are living as healthfully as possible. In folks who have progressive disease, especially if they are not having relapses and their MRIs are stable, whether or not they actually need a disease-modifying therapy is questionable, but it really does depend on the individual and the overall disease course. So I would say in the meantime, if you don't have access to a medicine, please make sure that you are abiding by health and wellness as closely as you can.
What natural treatments are available for bladder problems?
Not necessarily there are natural treatments, but there are lifestyle strategies that people can take in order to decrease certain bladder symptoms. So a lot of people with MS struggle with overactive bladder, that can lead to intermittent trouble with not making it to the bathroom in time and having incontinence. And I would say some good bladder health tips would be make sure that you are timing your voids throughout the day. So whether or not you actually feel that you need to go to the bathroom, every couple of hours you may want to go and see if anything does come out. I usually recommend absolutely in the morning after you get up, within 30 minutes after each meal, and then before going to bed, and then maybe 1 or 2 times in between each meal. So timing your voice can actually decrease that feel of urgency, so you're getting ahead of yourself. Another thing that would be important is just make sure that you are staying well hydrated throughout the day. Cranberry juice may actually help decrease the risk of urinary tract infections. And then also getting a good handle of constipation. So the bladder and the bowel actually have a very synergistic role together. And if someone is chronically constipated, that can actually have an impact on bladder health as well. So if you feel that you're also constipated, taking measures to try to decrease some of that and focus on bowel health, such as drinking plenty of water, increasing your intake of fiber during the day, remaining mobile, and exercising, because if you're not mobile, your bowel movements won't be mobile. And then even certain measures like elevating your legs when you're sitting on the toilet and having a bowel movement can also reduce some of the bowel dysmotility. If you get a good handle on the constipation, sometimes the bladder symptoms actually improve as well. And other things, please try to minimize caffeine and alcohol because those are bladder irritants.
Thank you. This question for Shaina: can I replace water with Gatorade?
Hi, great question. I get asked that a lot. To some degree, if that's what you have to do to get hydration in, that's okay. It's definitely best, though, if you're able to stick to water. Gatorade can have a lot of sugar in it. And also, if you go non-sugar or sugar-free, typically there are some kind of artificial sweeteners involved, and artificial sweeteners are also bladder irritants. So water is your best resort. And just actually going off of what Dr. Hersh was just speaking about, the more water you drink, the more that can help support a healthy bowel and bladder program. There's a lot more to it. It sounds like some people won't drink as much water because then they have to urinate more frequently, but it can help regulate more, especially if you do it in a balanced way.
Thank you. What are your recommendations for a healthy gut in terms of what to eat or drink?
Another great question. I would just recommend what we've been recommending all along, a healthy anti-inflammatory diet, making sure that you are remaining well hydrated throughout the day. There is a very important role and collaboration between the immune system and the gut. And making sure that you are introducing as much whole, healthy foods as possible will help maintain good bacteria in your gut as opposed to bad bacteria that can lead to infections and autoimmunity. I would also say that probiotics have sometimes been advised as being helpful. So eating things like Greek yogurt, that's a really good source of probiotics. But again, limiting processed foods, limiting sodium or foods that are high in salt, limiting saturated fats, all of those things will be good for overall gut flora.
Why is exercise bad before bed?
As Dr. Hersh stated earlier, exercising before bed releases endorphins, and typically exercise can elevate a mood and get your body going. So if you're trying to go to sleep, it's going to be typically pretty hard to fall asleep right away, and then that can lead to a bad cycle for your sleep habits. So if you exercise right before bed, then you may be trying to go to sleep and having trouble falling asleep. Thus, you get less sleep, and then the next day you're fatigued and then need more. So it starts to impact your sleep cycles.
Thank you. Another question for you, Shaina. What do you think of the up walker to use during walking?
That's a complicated question. The up walker is a great walker, but it's great for people that it fits. So I would tell you, if you have specific questions about a durable medical equipment or adaptive equipment, to speak with a physical therapist, because they can assess your gait patterns and determine what walker or wheelchair is best for your needs. I would say, as a therapist, that's one thing that we see frequently is people using devices that aren't necessarily appropriate for them, that maybe they saw a friend using or somebody else and thought that that would work good for them. But everybody has very unique balance and gait needs, and that's what we're here to help you with, is making those decisions. Overall, I like the up walker, but only if it's right for you.
Do you have any tips when gyms limit you to an hour a day?
That's a great question, especially right now with gyms limiting people because of the COVID virus. So I think that the best technique that I have people do is try to find ways in your normal activities of daily living to incorporate exercise, trying to get little bits of exercise in while maybe you can do balance while you're brushing your teeth, or maybe you can go for a walk in your neighborhood. We out here do live in Las Vegas, and that's not necessarily feasible right now because it's very hot. If you have a pool, getting in some aerobic exercise in the pool is a great way. But yeah, it's tricky. I would also say there's so many great resources online. None that I can specifically recommend because I don't know this particular person's specific needs. But if you go online, there's so many different types of yoga or Tai Chi or strengthening exercise. You can find those on YouTube or find local resources. I know out here in Las Vegas, we have virtual MS yoga and other courses like that.
Thank you. Do you have any tips for a neurogenic bladder?
Hi, Marie. We pretty much already talked about bladder control. Perhaps we can ask another question?
Sure. I'd like cardio exercise recommendations. My legs are not at all strong, and I have no access to a gym.
So if your legs are having trouble with weakness or spasticity, sometimes you need to use aerobic exercise from the upper body. So sitting and doing boxing or any type of exercise that's repetitive with your arms that gets your heart rate up is actually really good aerobic exercise. Again, you can try to find some videos online to walk you through that, or purchase a DVD for instruction of seated aerobic exercise. There's a lot of great ways to use your upper body to achieve aerobic exercise if your legs are unable. If your legs are able to move on their own, you may want to invest in a seated pedaler for at home. You can find those on Amazon or other websites. They are called, there's many different names for them. You can type in leg ergometer, that's ERGOMETR. Or a stepper. There's all kinds of different lower body exercise equipment that's less than $50 or $100 on Amazon or online that you can use.
Thank you. On behalf of MSAA, we would like to thank Biogen, Bristol Myers Squibb, Genentech, and Novartis for making this program possible. We would also like to thank Dr. Hersh and Shaina Meyer for the great presentations and our partners at Impact Education in delivering this program. This concludes our program. Tonight's webinar was recorded and will be made available on our website at mymsaa.org. There you will also find the COVID-19 and MS Pathfinder online tool providing information about the ongoing COVID-19 pandemic. Please join us on August 27th at 8 p.m. Eastern for the second program in this series entitled An Integrated Approach to Wellness for MS Patients and Care Partners. Please visit MSAA's calendar of events for upcoming webinars. I would also like to thank you for joining us this evening. Please consider completing a brief survey that immediately follows this slide. Please know that we are thinking of the entire MS community and hope that you and your families continue to stay safe. Thank you and good night.